So this will be an update on where I'm at with my cancer treatment at the moment. So this should answer a few people's questions, but it's going to be brief because I have to fit about 6 weeks worth of information into one video. So if you have any questions or anything you want me to go into depth about, just hit me up in the comments. So after my doctor's appointment and multiple scans, CT, MRI, PET scan, CT, colonography, a few blood tests, it was confirmed that it was colon cancer, but it had also spread to my liver and potentially my lymph nodes. I booked in for surgery to resect or cut out that section of colon where the cancer was. Regardless if it was cancer or not, though, I would have had to have this surgery just because it was blocking my colon, and that has risks in itself. There was a little bit of prep prior to surgery, mainly just restrictions on what I could eat and diet and that sort of thing. So on the day of surgery, which was about 2 weeks since my original colonoscopy, I met with the surgeon and his team, including the anaesthetist. There was also a chance that I may need a stoma or an ileostomy bag, which is very similar to a colostomy bag. So I met with the stoma nurse as well. So fortunately, the surgery all went well. The doctors and nurses did an amazing job, not just of the surgery, but making me feel comfortable the whole time. It turns out I didn't need a stoma, so that was great. However, it was confirmed that the cancer had affected my lymph nodes. When I woke up back in the ward, there were a few tubes coming out of me, pain relief, drain, catheter, oxygen, that sort of thing. But I was up and walking around showering within 24 hours of surgery, much to the surprise of my physio. I was in hospital for a total of 6 days, and as the days progressed, I slowly started getting the tubes removed, pain relief reduced, and started becoming more and more mobile. So once I returned home, there was still plenty of recovery to do, and whilst I was recovering, my team of doctors were running through what the next step in my treatment plan should be. So there were two main options, option one being liver surgery to cut out the lesions that were there and then start chemotherapy to sort out the lymph nodes, or start chemotherapy straight away after I'd recovered from the colon surgery. So up until a couple of days ago, we were going with option one, liver surgery, but I needed to get an updated MRI just to make sure nothing had changed too much there. Unfortunately, those 6 lesions have grown to 12 to 14, so that leaves us with option one and starting chemotherapy straight away. So I'll start chemo in 4 days' time. Obviously, the idea here is to stop the spread as soon as possible, and then potentially in a few months' time, we may be able to look at liver surgery again. So that's basically where we're at. Like I say, I ran through that super brief. So if you've got any questions or anything you wanted me to touch on a little bit more, hit me up in the comments and I'll do my best to answer any questions. Cheers.